On set, what is? Fine. 6 hours. Emily.
This is IVSA Expo, meeting number 45. Hello, good afternoon, everyone. So let's do good afternoon today. Let's say good afternoon in your mother tongue when your tables are called upon. Yeah.
Virginia.
All right, is everyone ready? Okay. I'll start with IVSA Australia.
Good afternoon.
IVSA China. IVSA Czech Republic. IVSA Denmark.
Wait a minute.
IVSA Germany. IVSA Ghana. IVSA Greece. IVSA Hungary.
Napot kívánok!
IVSA India. IVSA Indonesia.
Selamat siang.
IVSA Italy. IVSA Latvia. IVSA Malaysia. IVSA Morocco. IVSA Nepal. IVSA Pakistan. IVSA Peru. IVSA Republic of Korea. IVSA Serbia. IVSA Slovakia. IVSA Slovenia. IVSA Sweden. IVSA Taiwan. IVSA Thailand. IVSA the Netherlands. IVSA Turkey.
Günaydın.
IVSA United Kingdom.
Good afternoon.
All right, thank you everyone. We have 52.94% of attendance with the minimum quorum of 40% met. The GA can be proceeded.
All right, thank you for that, to RSG for the roll call. Next point on the agenda is the nominations for the Executive Committee 2026-2027. Do we have any nominations? Do we have any nominations? Ika.
Ika Desai, IVSA India, meeting number 13. I would like to nominate Catalina from IVSA Chile for the position of MD.
Thank you. Do we have anyone to accept on the draft? Alberta.
Alberta Afghan, IVSA Ghana, meeting number 28. I accept on the behalf.
Thank you. Do we have any other nominations for the Executive Committee of 2026-2027? Yes.
I'm Han, IVSA Republic of Korea. I'd like to nominate Donat Ndialwanda.
I'm sorry.
Can we have your full name and also link number? Okay, thank you.
I'm Han. I'm Sumu Han. I'm Sumu Han from IVSA Republic of Korea, meeting number 77. I would like to nominate Donat Ndialwanda from IVSA Rwanda for MOD position.
Thank you. Do we have anyone to accept on their behalf? Oh, we have a new hand up. IVSA Serbia.
Mikhailo Gmočki, IVSA Serbia, meeting number 40. I accept in behalf.
Do we have any other nominations? Also, please keep in mind for executive committee positions, you will need to ask the people that they are nominating for their second choices as well, so that you can provide that information to the election committee. Do we have any other nominations? Just for reference, once again, these are the current nominations that we have. For SG position, we have 2. For committee coordinator, 1. For MOD, we have 2. It will be updated. We will be provided with the correct information. For external relations, we have 3. For PRC, we have 4. And no one for treasurer. Huh. I guess Ivy's not been talking to our delegates. All right, do we have any other nominations for executive committee? Seeing none, nominations are now closed and will open again tomorrow. Tomorrow is the last day for nominations. So if you're still deciding or if you want to let anyone know, tomorrow is the last day to run. So please be careful about that. The chair will now entertain a motion to go into a 20-minute standard ease for the presentation of our partner, EAEEE. Peter.
Peter, Hills I is at Denmark bill number 14.
Wonderful. I so moved.
Thank you. The motion on the floor is to go into a 20-minute standard ease for the duration of the EAEEE presentation. Is there any discussion? Any objection? Seeing none, the motion passes and we are in standard ease. I will just get Pierre connected to the projector. I see your feelings. Yes. I see just yes. All right. Go ahead and start.
Education is an expanding world, and however, there are variability in culture, and resources, and regulatory framework. However, there is a great deal of convergence regarding the nature concern of veterinary education. And there is a growing demand for international mobility of graduates. So there is a local need for mutual recognition of qualification, which should be valid both locally in the country and globally internationally. So currently it is mainly a European association which accredits the veterinary education establishment, we call it VEES. While all veterinary education establishments are accredited by EVE in Europe, and they are subdivided into 8 regions based mainly on geographical area. But we have also associate member in non-European countries like East Asia, Middle Asia, Middle East, North Africa, and South America. And we have more and more requests for countries to become member of EVE and to be accredited by EVE. Our objective, of course, is to monitor the harmonization of veterinary education and to see if the VEEs are compliant with all 55 standards of quality of veterinary education. But our aim is also to reinforce the cooperation between members and to facilitate exchanges of information, staff, students, teaching material, etc. And altogether, this contributes to the enhancement of the quality of veterinary education and its adaptation to the requirement of the society. Of course, we had a close collaboration with the veterinary profession, both nationally and internationally, and with your organization. You know, IVSA is a strong collaborator. Every time we do a visitation for accreditation, we include one student approved by IVSA, and there is an IVSA representative in all committees of our association. So why to be accredited by EVE for your vet school? And the main reason is the need for mutual recognition of qualification to ensure the best mobility for staff, student, and graduate. And it also allows the alignment with global framework for disease control. You know that the pathogens that do not respect the border. And finally, it's allowed an extensive share of experiences and tools like e-learning, e-logbook, interactive video, virtual slaughterhouse, still labs, patients recording systems, assessment method. Today, thanks to artificial intelligence, translation is not a problem anymore, and the tool developed in one VEE may be used globally if appropriate. So I will now have a brief presentation about the essential role of skill lab and mock clinic in preclinical veterinary training. We are today in a changing landscape of veterinary education, and there are increasing societal expectations concerning animal welfare, including in veterinary education. There are a growing complexity of the veterinary procedure, both for diagnosis and treatment, and there is a need for graduates who are self-confident and competent from day one. And that's why it's important before to have a contact with live animal and to be really able to manipulate the bodies, etc., and to do a lot of procedure with emphasis on safety, ethics, and standardization. The ethical imperative is really more and more important globally. In the past, the training really heavily on live animals. This is not accepted anymore. The current principle is never the first time on a live animal, or blood sampling, or any other classical procedure. And anything must be done to avoid stress, risk, and welfare implication. And regulatory bodies in many countries increasingly promote alternative methods for pre-clinical training. Of course, clinical training on patients remain compulsory and essential after this pre-clinical training. What are the skill labs? In fact, it's a dedicated spaces for hands-on practices where they are equipped with anatomical model, with task trainer, with mantines, mummies, and with simulator. And there are low fidelity and simulators or high fidelity simulator. Both of them may be useful for this pre-clinical training. And all of these equipment are designed for repetition, mastery, and safe experimentation. What are the mock clinics? In fact, it's simulated clinical environments which allow to replicate consultation room, operating theater, hospitalization wards, and all different diagnostic area. And it allows students to practice communication skills, the clinical reasoning, to work in a team, and to be trained with the usual patient flow in a veterinary clinic. So why simulators matter? In fact, it's a clear bridge, a way to bridge the gap between the theoretical training and the practical core clinical training. It allows students to apply theoretical knowledge in realistic component without any damage to the animal welfare. It supports progressive skill acquisition and therefore reduce cognitive overload during the first real clinical encounters. And self-confidence of the students are essential when they arrive in the veterinary teaching office hospital and when they face real clinical cases. So there are many benefits of skill labs and mock clinic. The first one is a safe space for learning. And students can make mistakes without any consequence for the welfare or the health of an animal. They are encouraged for exploration and experimentation. It reduces fear of harming animals, and it helps to build confidence before the clinical rotation. Another benefit is unlimited repetition. When each student progresses at its own pace, and we all know that mastery of a technique requires practice. And sometimes you need to do it several times before to be able to do it correctly and to be self-confident. And the skill labs allow the repetition of the procedure as many times as needed, and the refinement of techniques and the development of what we call muscle memory or automatization of some procedure. Another benefit is standardization of learning procedure. So all students in one cohort can practice exactly the same core procedure in monkeys and mummy, which ensure and you know, are in a run. You may be lucky to have many skills and one clinic. Every student receive exactly the same training, and therefore it reduces the dependence on unpredictable clinical case availability in the veterinary teaching hospital. And it also allows fair and objective assessment of the student by the teaching staff. Immediate and high quality feedback is also a benefit, and the instructors are able to observe the student closely to immediately correct the error and to prevent the bad habits when the student do, for instance, a surgical procedure, a suture, or something like that. And sometimes the use of video allow the self-evaluation by the student to see what was wrong or what could be improved in the procedure. Better prepared clinical rotation, and clearly the student after an efficient pre-clinical training enter the clinic with greater confidence, better technical skills, and of course also improved communication abilities with clients, with teachers, with nurses, with technical support, etc. And also with the animal. And altogether it reduces the stress during the first clinical rotation, and this has been clearly confirmed by surveys done by students in veterinary education establishment which implement skill labs and mock clinics. Finally, it also allows to enhance the patient's safety, and there are fewer errors during the procedure of live animal. The performance are more consistent, and the student usually better understand the risk, and which allow to improve the outcome for animal patients. Digital tools and artificial intelligence may also help a lot in skill labs and mock clinic. Artificial intelligence enhanced simulator allow to help for diagnostic reasoning, for surgical planning, or for monitoring of physiological response. There are also development of many digital platforms for the tracking progress, for providing personalized feedback to each student based on his or her skill and ability. And these digital platforms allow also to simulate rare or complex cases the student may not see in the veterinary teaching hospital because they are so rare or so complex. So I want now to show you an example of a state-of-the-art skill lab and mock clinic which has been developed in the University of Liège in Belgium. It's my university, so because it's my university, I present it to you. But honestly, I believe it's one of the most significant one in Europe. But there are more and more skill labs and mock clinic available everywhere. The first thing you need for an excellent skill lab is an excellent team. And in the team, you need to have first good IT expert allowed to develop the whole procedure. Secondly, you need a good technician able to develop the models, the monies. If you can buy monies in private company, but it is extremely expensive, and most of them can be built by an excellent technician. And then you need the teaching staff, which should be both a teacher in preclinical training and clinicians from the veterinary teaching hospital. Secondly, you need the rooms, the facilities. So hopefully in the University of Liège, we had the new veterinary teaching hospital, and therefore we decide to use the old one as the preclinical training with skill labs and mock clinic. So we have here the welcome room for for the student. Here we have the office for the staff, and then we have many different rooms based on the species, like pigs, equine, horses, ruminant, new companion animal, exotic pets, etc., all based on discipline. Like here, urinary testing, internal medicine, cardiology, anesthesiology, ecography, radiology, reproduction, surgery, dentistry, endoscopy, and here we have the biosecurity procedure. The third thing you should have is a laboratory to create the models and the equipment. As I told you, it's much cheaper to do it by a good technician, and for that you need very few equipment, and ideally you need a 3D print. Many mannequins are built by a 3D printer, and these printers are now available in many universities. The next important thing is to have appropriate documentation for each procedure. And there should be a QR code and to allow the student to prepare for the procedure. And for instance, here is an intravenous catheterization. Everything needs to be described, the purpose, the prerequisite, the preparation, the procedure, and then you need to explain how to do it. You need to explain what not to do. And this is the preparation of the skill lab, which should be available online for each student. Then you have the different skill labs, the different rooms. For instance, here is the equine rooms, where a student can practice several procedures. Classical procedure is intravenous sampling or injection. It needs to be done in all common species. Another important procedure in the horse is nasogastric tubing. You know, in colic horses, this is a very important procedure, and it's really essential to do it correctly. And why is it important to do it correctly? Because for many colic horses, you will have to do a sampling in the stomach, but also to administer some liquid drug or some paraffin oil, etc. And it's essential to be in the stomach and not in the lung. And this is a quite frequent error, and it's a dramatic error. And when you send 2 liters of oil in the lung, it's there forever. And then there is no other option than to euthanize the horse, unfortunately. So it's extremely important for the student to know the procedure, how to reach the stomach, and for instance, to palpate here and to the strong tube, the trachea, and the tube, and you are fitting in the stomach. Other important procedures are rectal examination, and before to do it in a real animal, it's important to know what to expect to see and how to do it, like urinary system, reproduction system, part of the digestive system, and the teacher must be present to help you how to do it and what you should feel in an adult horses. Other important procedures in horses are bandages. It's important